are real problems to face. So the big ongoing challenge of the NHS, and for me too actually, is that as long as we're in a world without a vaccine and without a really efficacious treatment, then running COVID compliant pathways through healthcare organisations massively reduces capacity. People are talking about 30 or 40% reduction in available capacity on a system that already ran hot. I was going through some of the granular detail of that for my own services yesterday. So just to illustrate right at the granular level where this loss of capacity comes from. So in my operating theatres, the guidance suggests that in order to maintain safety, in addition to a whole range of other things we do about cleaning and so on, we have to do 5 air changes in theatre, completely change the air in the theatre between each patient. And in our best theatres, our laminar flow theatres, that takes 12 minutes, more typically 15 minutes. But in our endoscopy theatres, which rooms really rather than theatres, and endoscopy is one of the most aerosolizing procedures. It's got one of the highest risks. It might take me half an hour to achieve those air changes. So for a 10-minute procedure, half an hour between patients. So these are staggering reductions in available capacity, and we're trying to look at all. And by the way, anyone on the call who's got innovations that target those things, now is the moment, because that's a real business case for things that might have been. So, for example, it now looks, it's really interesting for me, is that the business case to put new air change plant into my theatres, which ran on lower air changes, might all of a sudden be unanswerable to make that change. So we're going to need massive innovation, and medtech and pharma and all those folks who can help in those individual parts of the pathway to unlock those elements. That stuff now has a much harder business case, sorry, a better business case, harder edged one than it did 6 months ago.
What are the real drivers there? So, I mean, obviously within looking at a constrained capacity and at least, well, a lag in demand, a lag in flow, probably the same demand, but just, you know, pushed down the line. But what are the drivers for you in innovation? Is it about trying to stop those patients ever turning up? Is it getting them through quicker when they are there? Is it about having greater efficiency in process, or is it a bit of a
yes? So yes to all that. So if you run the numbers, and I've run the numbers on secondary care, it's pretty scary. That's why you saw those stories of 10 million people on waiting lists. We've already lost 3 months of surgery. That's 700,000 patients a month. The figures are slightly helped by the fact there have been very few referrals. We presume most of those people are still sitting at home with their knees deteriorating and their hips deteriorating and their hernias getting very uncomfortable. So we think most of that will reappear at some point. So you could get to 10 million people. That's not my numbers. Those were numbers coming out of the NHS. I think they might be a little high, but they're not off the scale high. And from an NHS that was already struggling to maintain parity, so you know we need to do our bit. The private sector can't do all of the elective surgery. Even running full CAT, it's only going to do 15 or 20% of that contribution. So it's got to be a supplement to what the NHS is doing. So I think we're going to need innovation at every point along that pathway to alternatives to surgery, but when the surgery is needed, to just so we were very proud of the fact that we could run a successful business off NHS tariff, which meant that we had to be really efficient, and we really worried about 5-minute transitions between patients. If we got that right, we could get an extra patient on the list, do that well and safely, and have optimized our theatre time. So we've always been red hot. So when we see a number like 15 minutes between patients in our best theatres, that's terrifying to us. So anything we can do, we're scouring the world at the moment for incremental innovations we can make right across the pathway that give us back 5 minutes, 2 minutes, you know, that in order to keep throughput through for us, for our business, but also for the NHS, just have baseline capacity to be able to continue to make some kind of reasonable offer to the population.